Hello, and thank you for joining me on the Dr. Suzette Glasner Podcast. Don't forget to hit like and subscribe if you want to continue to learn from me. I am often asked, how do I talk to my loved one, my friend, or my coworker about their substance use? I am worried, but I am also really afraid to bring up this subject because I think it's going to make the other person defensive or mad at me, or I'm going to say the wrong thing and set them off, and it's going to have negative impacts on our relationship and not help anyone at all. That's a very understandable concern and worry because substance use is something that people tend to feel very ashamed of when it's brought up. And it's really easy to put somebody on the defense about that topic, and that doesn't usually end well. So we're just going to briefly go over 3 techniques that you can use when you're talking to someone about a very sensitive topic that you're worried is going to make them defensive and ultimately that you're going to suggest that they change. The first one is listen and don't tell. What I mean by listen, don't tell is not don't tell them anything that you're concerned about, but it's just coming from a place of being committed to listening to what they have to say. So you're not going to interrupt them. You're not going to answer for them. And this is harder than it sounds. I would keep this part very brief though. I would not go into it while they're sitting on the other side of the conversation, bubbling up internally and getting all defensive and thinking of every counterpoint to you. I would keep it brief and say, hey, I've just noticed that there's something a little different about the way you've been acting when you're drinking or about how much you've been drinking. And I just wanted to check in with you and see if you're okay and or if you've noticed anything like that. And that's it. Then you open up the floor for them to say, yes, I've noticed that. No, I haven't. I don't think there's anything wrong with the way that I'm drinking. And then whatever they say to you, you just try to show them you're listening by reflecting it back. Like, okay, it sounds like you're not worried about this at all. It sounds like maybe you don't even feel like it's different from the way that you were drinking before. And even a statement like that, if it's truly genuine, it might open them up to change their statement and to say, well, maybe it is a little different, but I'm not worried about it. And then you could reflect that back and say, okay, so you've noticed a little bit of what I have, but it's not something you're concerned about right now. Maybe I'm alone with that. And then wait and see what they say. But you're going to try to have this continuous back and forth where maybe you ask them a few questions like, well, what have you noticed is different? Or is there anything about it that concerns you? Or do you feel like if things stayed the same way that they are right now for a while, that would be okay? Or would that worry you? So you ask them a few different kind of clarifying questions, but then you really truly give them the floor and listen carefully to what they have to say. And even if you don't get to a point in this particular first conversation where anything has changed, you've potentially opened up the door for them to have a conversation with you about this that is not inflammatory or angry or argumentative. So your goal is just to have a conversation and to show them that you're listening and that you care and to express some concern, but not in an overly dramatic or intense way. That's what I mean by listen and don't tell. And when I say don't tell, I mean don't tell them what you think they need to do. Don't tell them what they should be doing. Don't tell them what you think is wrong with them. In this initial conversation, you're playing a role more as a listener than as an advice giver. And that's how you're starting to build that rapport that will enable you to give them advice maybe a little bit later. The second piece of advice I have may seem very counterintuitive, and that is to not be afraid to acknowledge that there's something positive for them about drinking or using substances. And the reason you want to do that is because when you come at someone with this sort of mindset that everything is bad about drinking, everything is bad about cannabis, everything is bad about some other drug that you're worried about them doing, let's say stimulants, then you lose the credibility that a person who's showing that they understand the reasons for another person doing these things would have. And you want that credibility because that's going to open doors for you to be able to make suggestions later that they will feel a greater sense of trust in you about. So the worry that often people, when I'm training psychologists and therapists to acknowledge the positive, well, what if I say I get why it's good? Am I condoning it? Am I reinforcing it or making it feel like it's okay for them to use it more? And the answer is it may feel like you're doing that, but it's more so that you're demonstrating an understanding because people who use substances and maybe use them too much aren't crazy. They're using them for a reason because they were benefiting them in some way at some point in time. Even if those benefits are starting to diminish now, they were using them for some reason. Maybe Maybe alcohol helped them relax in social situations. Maybe weed helped them to sleep at night, or they felt like it did. Maybe alcohol helped them to escape from some other feelings that they didn't want to feel. Is that the healthy way to escape from emotions or to manage emotions? No, but the person doing the behavior is perceiving a benefit from it, and acknowledging that goes a really long way toward making the person feel like you're there for them and you're there to listen to them. And again, it gives you more credibility when you want to turn around and say, okay, like, I understand. You've been finding that this helps you relax, or it helps take the edge off after a long and stressful day. You have a really stressful job. Showing that understanding then gives you the currency and credibility to be able to turn around and then say, okay, so I get it was benefiting you. Is there anything that you feel like it's doing now that is not beneficial? Because I see some differences in you that are a little bit worrisome. You have the credibility to say something like that after you've acknowledged that you get what they were getting out of it. And making that statement is not going to make a person more likely to engage in an addictive behavior. It's actually going to help make them more likely to come out of that set of behaviors with your help because they feel understood. My third piece of advice is show compassion even when it's hard to. And the reason I say even when it's hard to is because when you see somebody doing something that is self-destructive, like repeated drinking or substance use in a way that leads to some very impactful consequences, not only on that person, but on people around them, it can be very frustrating to watch them do these things. And it seems so clear to you that they need to change in some way, but yet they still keep on doing the same thing over and over again. And that is the nature of addictive behaviors. And they often don't occur in a vacuum. Usually there are other things that are going on that are contributing to those lapses in good decision making. Part of that can be the impact of repeated substance use on the brain structures that control decision making. So the compassion goes a long way. And how do you show compassion? It's a lot of what we've already been talking about. You listen, you say things like, I understand this must be really hard for you. Or I understand that even me coming to you and saying what I'm saying right now may be really difficult to hear. And maybe other people are saying these things to you as well. And you might feel even very misunderstood. But I'm here to say, I know you're going through something and I want to be of help to you. If you're coming from a place of wanting to help, I want to support you. I want to listen to you. I want to be somebody who you can lean on. That again is opening up the door for them to talk to you. And if they're open to talking to you, then you're going to get more information from them about what's really going on, because with substance use disorders, there's a lot of lying, there's a lot of shame, there can be a lot of secrets. If you truly want to help your loved one, then creating an environment where they feel like they can tell you some of the secrets and some of the things that would have ordinarily made them feel ashamed, that opens more doors for you to be able to do something helpful. So I hope these 3 suggestions are going to help you navigate that next difficult conversation. Thank you so much for tuning in today, and I look forward to seeing you next time.